So I just wanted to welcome everybody on. This is the Parkinson's and Healthcare, Navigating the System and Getting Your Power Back. And we're live. So I'm sitting here talking to you thanks to the interweb. So I love this technology. You can watch it in the comfort of your home and get educated and get some good information there. So we are going to get started here. So welcome all. And I wanted to introduce myself. So you're in the right place here. If you want more than a 2-minute conversation and a prescription from a doctor, you've read all the books, you've taken all the courses, and you're still not getting the results you want. You know, there's a lot of information out there online. A lot of it isn't super helpful, and we haven't had any breakthroughs for you all in this chronic neurodegenerative state, and Parkinson's in particular. And I'm going to share with you how I came to this place of sharing this information, some questions I've learned over the last 2 decades of medical practice in the wonderful state of Oregon, and then also some steps that you all can take moving forward. So hope to give some really great value today. And as any questions come up, please type them into the chat box. We'll answer them. We'll stick on here to the end. And then finally, you know, you want clarity in how you can proactively take care of yourself. You know, all too often I hear from my patients, and maybe this is you sitting there, you know, you got the diagnosis of Parkinson's, and maybe you're on medications, maybe you're not, maybe you're contemplating them, or somewhere in between, or have a family member with this diagnosis. And you know, there's been no breakthroughs over the last 250 years of us knowing about Parkinson's disease, right? We have some medications that can placate symptoms, and we're going to talk about those today, and possibly a different approach. And then finally, if you're just tired of being constantly monitored, but never given any new direction, you know, I hear often from my patients, they go to see their neurologist on an annual basis, and it's serial monitoring, right? You get run through a battery of tests, talk to, listen to, and then evaluated. And at the end of it, you know, really, what do you got at the end of that? You know, the doc says, okay, we'll see you next year. And, you know, I got the feedback from folks like, I'm really tired of being serially monitored. Like, I'm just, you know, I'm evaluated, but there's been no breakthroughs here. And so we're hoping to change that, move the bar for folks. You know, today we're going to cover 3 steps. So we've got the key questions to ask your healthcare provider to find out if you have options that you haven't looked at yet, which is such a huge thing, right? You get put into this pigeonhole or category of movement disorders with Parkinson's disease. And we've just found there are things that we can employ right from your home starting today that can move the bar and move the needle and make a difference. So I'm really excited to share those questions for you and some of the solutions. How to navigate the system, right? You get into that serial monitoring and kind of just stuck in it there. And, you know, if you're not advocating or don't know about what options you have, you know, it can be super frustrating and overwhelming, and sometimes just downright depressing, right? I have tons of patients in the clinic at Nature Cures that, you know, before they got to us, they were just, you know, similar situation of maybe they're on Sinemet or carbidopa, levodopa. Maybe some were contemplating the deep brain stimulation with the medical implant into the brain. But what I found in common is none of them had a complete assessment. So we're going to look at that. And then the third part is get your power back. So, you know, how you can actually make the best choice, making sure you have all of the information you need to actually make an informed choice. So we're going to talk about that throughout this morning. We've got the next hour here together. So let's launch in here. And then also I want to give you some encouragement, stay to the end, and I'm going to share my brain health smoothie recipe. This is a medicinal smoothie that I think, you know, we all should be taking on a daily basis. We are exposed to a lot of chemicals in the United States. So I'm going to talk about that in the testing part of the morning webinar here. But this smoothie was specific. It's a bunch of superfoods for your brain. So stay to the end and we'll make sure we get that to you there. All right. So my story, I am Dr. Greg Eckel of Nature Cures Clinic in Portland, Oregon. I've been in practice since 2001. I'm the past board chair of the Oregon Board of Naturopathic Examiners, appointed by the governor. I spent 6 years in that role. I've held various chairs in the state association and the national association. I'm an international lecturer on brain health and neurodegeneration. I've spoken at the American Academy of Environmental Medicine, American College of Advancement in Medicine, the American Association of Naturopathic Physicians. I've been interviewed by TAP, the Teach, Advocate, and Practice. This is a consortium of integrative care providers. I've been dubbed North America's Parkinson's expert as a result of that and the research that I've done. And more importantly, what you see here is my family. And what I'm sharing with you is a piece of what I call Soraya's gifts. I lost my wife last year to a chronic neurologic condition called Creutzfeldt-Jakob disease, which most people have not heard about. It is mad cow syndrome in people. And you might be thinking, well, that's not Parkinson's, doctor. But what I found, and there's Soraya, we were big hockey fans, and with our kids out here and some of the travels that we did. Recent one of our kids, one Caden there, and the tall guy in the middle going to college. And so, what I discovered in neurodegeneration is there's not a lot of solutions, right? Creutzfeldt-Jakob is a very rare disorder. It's 1 in a million, about 300 cases a year in North America. And there's no known solution. So what you get with that diagnosis is, one, you don't get the diagnosis until you pass. They offer you a free brain biopsy to just confirm that is indeed what you had. And it was a very long and arduous route through the medical system. So I know it firsthand personally as husband and father and as provider and physician, went through this. And what I did, I swung for the fence, of course, looking for some solution for my then wife. And, what I uncovered are what I'm calling Soraya's gifts. And that's what I'm sharing with you all today. And really what is the focus of my practice and purpose, passion. It's really transformed the work that I'm doing at Nature Cures. I developed a fancy approach, which is capital F, capital A, capital N dash capital C, the FANC, which I will go into details here. And, I have been in service to people. That's why I went into medical school. Naturopathic medicine and Chinese medicine is my background. I've grown one of the largest integrative clinics in the country. I'm the chief medical officer for a stem cell affiliated network of providers across the country, in charge of ensuring excellence in outcomes. It's called the Go Wellness Stem Cell Affiliated Network. And we have over 50 physician provider offices across the country doing this work. And we've got, a big mission. And one of the things that I want to do is really move the bar in neurodegeneration, because there hasn't been a lot. There's been actually no breakthroughs. And I know firsthand how frustrating it can be moving through the system, especially with some healthcare issues on board. And what we went through was a healthcare crisis. But, depending on where you're at on the continuum of care for Parkinson's, maybe you're newly diagnosed, maybe you've had it for a long time. I'm hoping today to provide you with some new information that opens up some doors of possibility, and even, gives you a little bit of hope, and let you know there are a lot of physicians out here that are working really hard to come up with some solutions and find some breakthroughs. So I'm really excited to share that with you today. So the neurodegeneration in general, the specific path that I had with Soraya was, just a really fast degeneration of the brain. And it kind of came on very subtly, and perhaps this is with your symptoms as well. They develop not overnight. So it was like a slow slide into what it looked like for us was dementia. But that slow slide took 1 to 2 months. So I guess it wasn't that slow, but in retrospect, some of the early warning signs were there before. And we'll talk about some early warning signs for Parkinson's. But my guess is if you're on this webinar today, you have the diagnosis or have a loved one with that diagnosis. What I went to see all of the specialists, the neurologists. I was consulting with physicians around the globe. Case Western is the Prion Research or Surveillance Center in North America. And that's the overlap here with neurodegeneration. What I uncovered was these prions, which are unfolded proteins. When you get the prionic textbook, and I have the second edition, which I did, and I read it cover to cover, you realize all of these other neurodegenerative conditions have misfolded proteins. In particular, with Parkinson's disease, we've got alpha-synuclein. And dementia, we've got the beta amyloid plaques, and Alzheimer's beta amyloid plaques. So they're very similar in activity, and that's where I made the jump over and really started investigating Parkinson's in the same vein. And lo and behold, really uncovered some astonishing information for you all. Our journey, continued. We went to all of the specialists, really just declined really quick. And then once you get into neurodegeneration, you have to really get a great differential because, as you know, there's no imaging or no lab test that says you have Parkinson's. This was the same for Creutzfeldt-Jakob disease. This is the same for dementia. This is the same for Alzheimer's. It's all on a clinical diagnosis. And so what we uncovered were some amazing overlaps and possibilities that, one, let's make sure you have Parkinson's, because I've seen patients when they get into the clinic and or we do some assessments with them via online portal. Lo and behold, they don't even have Parkinson's disease because, when the diagnosis is made by, well, let's give you carbidopa, levodopa and see if your symptoms improve. Well, that is not a great assessment of whether you have Parkinson's or not. And there are about 5 different subtypes of Parkinson's as well. So what I became is basically a brain regenerative specialist by talking to all of the world-renowned experts in brain in neurodegeneration. So we were at University of Pennsylvania, Case Western, all of the hospital system in the Oregon region. And then I went abroad as well, asking for support and information, globally. So what we're doing is bringing that back. So here's a picture of Soraya. These are the gifts. I just sought out these solutions, and they're evidence-based. I went on to PubMed and looking at research and really wanted to move the needle, in particular for Soraya. Unfortunately, did not help her, but I've put it into my clinic, pardon me, and we're really moving the needle. While I'm not saying I'm curing Parkinson's, we're definitely improving folks' tremor. We're improving their speech. We're improving their gait, their stability, their energy. We're most importantly improving their quality of life. If folks are just coming on now, I want to encourage you to use that chat box. This is Dr. Greg Eckel, and we're talking about neurodegeneration, and in particular, navigating the system for Parkinson's, and how I got to lecture to you today on this webinar, and these gifts that I uncovered looking for a solution for my wife who passed last year. So these gifts that we uncovered, one is in the assessment realm, and then 2, it's really in some treatments and in my fancy approach of what I put together. F stands for functional, A stands for assessment, N stands for nerve, and it's a -C, capital C. C stands for cellular regeneration. So we'll talk about that today. We do get results for our patients, and you go into conventional docs and the neurologists, they don't see people improving, and it can be very frustrating, especially being the patient in that situation, right? If anybody has had that experience, please put that into that chat box there. I would love to hear from you. Helps get me energized and know that I'm serving you. So if you've got specific questions, please put them in there as well. Yuli put a little tag up there, said, if you have any questions, please go ahead and put them up in there, and we'll answer those at the end of today's talk. So I am the nation's leading naturopathic physician in neurodegeneration. And this component, I got flown to Chicago last January and got interviewed and recorded on my protocols that I put in for Parkinson's disease. What we're finding across the country is most primary care physicians think there is nothing that we can do for you with this diagnosis. And my job and what I'm doing for them is to educate them. Actually, there is a ton that we can do, and you all are not getting complete care unless you're asking the questions what I'm going to share with you today. And then also looking at some alternatives, and these are the things that I discovered along the path here in what I'm calling Sarai's Gifts. So this is me on the kind of the morning show. I'm the resident naturopath in Portland TV for a wide variety of health conditions. I got flown out in January, like I was saying, to tapintegrative.org. You can check them out. It's a CE, continuing education portal for other physicians across the country. And they pick the best of the best to present their material. It's all evidence-based. There's research to support everything that I'm going to tell you today. And, what is kind of uniquely positioned me as my personal tragedy with losing my wife and, going through this whole system personally, and then also the research that I uncovered. And so what we've got, what we're going to start out with are the key questions here. And these are things that I've found through the last 20 years of practicing medicine that you really need to know of your providers that are helping you. So, oftentimes I hear from my patients like, well, my neurologist never asked me that question. Why aren't they asking that? Or if this is so well known, why isn't it in everywhere? Well, those are very valid questions. And what my retort is that it is called the practice of medicine. And when you look at your physicians in the clinic, for their continuing education, it's limited state by state by how many hours they have to do. And typically they're running very rapid and they're overbooked, and the system is a little bit overburdened. I don't know if you've noticed that yet or not. And they don't have a lot of time to spend with their patients. So where they get their information is really on the fly. Sometimes from their societies, and then a lot of times from the drug reps showing up in the office. And so these are questions to make sure that you are getting complete care and you're getting, what all of your options are. So just imagine having a conversation with your neurologist where you're in control and there's actually something that can be done for you. So the problem, we have no corrective solutions, right? That's what we hear. There's been no breakthroughs in Parkinson's disease over 250 years. And what I've found is the reason why there's been no breakthroughs is we're looking at the wrong issue, right? We are looking at the very end product of a disease process. Some of the symptoms could have been 10 to 20 years before the tremor started, or before the speech, or before the gait, shuffle gait, along those lines, the rigidity. So I really do think we're looking at it wrong. And so really what that provides us is an amazing opportunity that you actually do have options, and you can take proactive steps and not just prescribe and wait for the decline. I've seen so many patients, 8 to 13 years on carbidopa, levodopa, and it's not working anymore, or it never really worked in the first place, right? Does anybody, go ahead and put this in the chat if you've experienced this with really trying to time the carbidopa, levodopa, and it's wearing off in 3 to 4 hours, and you're looking to really maximize the peak effectiveness of that medication. It doesn't do anything to correct the underlying imbalance. So what this provides us is a huge opportunity for you. And what you're going to learn today are some of the questions. So here's key question number one. Do you test for mimicking conditions? Meaning, again, there's no blood work or there's no imaging that supports the diagnosis for Parkinson's. So it's full on clinical assessment. And then in reality, what happens is, okay, we suspect you have Parkinson's, so we're going to prescribe you now Sinemet or carbidopa levodopa. And if your symptoms improve temporarily, well, then you have a definitive diagnosis of Parkinson's. Well, that's not entirely fair, because I've seen patients where they had a hormone imbalance, and in particular, their thyroid. I've seen patients, they've had viral loads that were very high, and we treated those and their symptoms got better. So you want to make sure, you want to know, are you testing from your provider? Are they testing for other chronic neurodegenerative conditions? So what are they? They're demyelination syndromes like multiple sclerosis. They're blood-brain membrane disorders. There's optical, so your vision, and autonomic system disorders, so on the nervous system. There's peripheral neuropathies that could be in there. And there's also things that cause a brain autoimmunity. So symptoms that could mimic Parkinson's or some of these other conditions are ataxia, which is the speech issue, sensory loss, you're not smelling well, the neuropathies, pins and needles, or feeling like you got a bunched up sock in your shoe, photosensitivity, so trouble with light, going out into really high intense sunlight, muscle pain and spasms, muscle weakness and atrophy or shrinking of the muscles, orthostatic hypotension, so do you get dizzy with position change from sitting to standing, or from squatting, maybe you're out in the garden and standing up? Do you get dizzy with that? Chronic pain, fibromyalgia pain patterns can also mimic some of the things in Parkinsonism. Memory loss or brain fog, you can start developing certain dementias associated around this, and then other autoimmune conditions. So question number one, do you test for mimicking conditions? So make sure you get that. We can also email it to you if you're having any difficulty writing. Number two, do you provide a nutrition plan? So what I've discovered over the last 2 decades, food really does matter. Food is your best medicine. When you go to see the neurologist, they'll poo-poo that. They'll say, oh, that's, that it doesn't really matter. At this point, you have this dopaminergic receptor site issue, and the neurotransmitters are not working well. And so we're going to give you a medication just on that one pathway, which, as we can see, does not work well. So nutrition, food is your best medicine. I've got some pictures here of some delicious fats. The essential fatty acids is the salmon on there. And then essential amino acids in the nuts and the salmon. These things are called essential, is that essentially your body cannot make them. So if you do not have them in your diet, guess what? The building blocks for your body can't heal. Your body can't heal. It doesn't matter what good medication we put in on top of that if you don't have these building blocks in there. So you definitely want a health coach nutritionist on board to make sure you have your essential fatty acids and essential amino acids on board in your diet, right? Not doing a ton of sugars, diabesity of the brain. Basically, there's a dementia, 5 forms of dementia that we're discerning, and one of those is from too many sugars, right? So if you're eating a high carbohydrate diet or processed foods. So we definitely want to make sure you've got somebody on board, in particular your main provider, that's asking you these questions. So, make sure that you're getting complete care. The third is, do you provide an exercise plan, right? Movement has been shown to slow the progression of Parkinson's. And there's great ways of doing this, right? So there's one of my favorites is Qigong. And in Qigong, what that is Qi is energy and Gong is work. And so it's kind of like Tai Chi. If you've seen the pictures of a lot of Chinese in the squares in the morning, they're out doing their Tai Chi, which is very energy, right? So Tai Chi is underneath the umbrella of Qigong, but these are subtle movements of the body to help integrate the right and left hemisphere of the brain. Well, okay, maybe that's not your thing, but walking will do it. Yoga is awesome. There's been some research on showing dance slows the progression, drumming slows the progression, boxing slows the progression. You know, Muhammad Ali with his Parkinson's was when he would go out with the Parkinson's, and at that point he had a pretty profound tremor and stutter. He would go out in his back garage with the punching bag, and after doing the punching bag, he said he got a 5 to 6 hour relief at the beginning of doing that from some of his symptoms. Now, so there's Rocksteady Boxing as a national organization that they have clubs around the country. So I definitely want to make sure you're getting plugged in with some exercise and some community. I'll put a plug in for the Brian Grant Foundation. He was my favorite Blazer, Portland Blazer basketball team of all time. He developed early onset Parkinsonism and Parkinson's disease, and he's got the Brian Grant Foundation. I believe he was diagnosed at 37 years old with Parkinson's. And on their website, they have a great library of free videos for exercise. So, I want to make sure that you're plugging in there, but you want your provider to be asking you these questions, because to ensure you're getting a comprehensive treatment program that's tailored specific to you. So third key question, do you provide an exercise plan? So a story, this is a great patient of mine, Mark. He's a successful business owner. He has hundreds of employees in town. He's super active. He's an out-of-the-box thinker, and he actually discovered us in Portland from word of mouth from a coworker. At that point, it was many years ago, San Francisco State University did a retrospective study on the effectiveness of acupuncture for Parkinson's disease, and they showed that it was very favorable as compared to just placebo or medication or placebo. So, he came asking questions about that. Well, one of the big things for Mark is we tested his hormone balance, and this is in the next part. I'm going to cover testing, but I wanted to give you a story of someone that may have similar picture. Right? Everybody that I see, we treat as individuals, as unique, heart-centered beings moving through time and space. So we want to tailor a comprehensive program directly to the individual, right? So it's not a cookie cutter approach. We don't just run the same supplements or program on everybody that comes through the clinic, because there's different reasons why you may be having your symptoms. In Mark's case, he still does have hypothyroidism, and I mentioned that earlier in the webinar. There are case studies on PubMed, on the research database of peer-reviewed journals, showing if you have, and some of my colleagues actually call Parkinson's hypothyroidism of the brain. And that was the case with Mark. He had, he doesn't have the tremor component of Parkinson's, but definitely on the speech part. And that was really getting him down, because he leads meetings at work with these hundreds of employees. And as one of the owners of the company, he's really involved with it. And that was really slowing him down. His gait, also the shuffle step gait and instability. He was a big runner, football player in college, and wasn't able to be as active anymore. And so we brought him into the clinic, and we did what I call is my fancy approach, my functional medicine, assessment, nerve health, and cellular regeneration. And we found out, okay, we tested him for heavy metals. He didn't have those. We tested him for viral load. He didn't have that. We tested his hormones. Bing, bing, bing. Hypothyroidism. We want to make sure that's optimal. And then we're just getting ready to test him with the gut health, which is a piece that I put into this presentation. Some really exciting stuff coming out on the microbiome. But so on the fancy approach for Mark, he was able, just recently, his son got married. They had the wedding at their house on their property, and he was able to attend fully functioning and participating in the wedding. It really warmed my heart that he was able to do that, move around. He's able to be at work. He stayed engaged and active. couple months back, an employee came up to him after a meeting and said, "Mark, something's different. Like, I could really understand your language." And so, he's getting this kind of third party feedback, like, wow, the treatment actually is working. And we did the full court press with Mark, right? He came in, we did an hour assessment with him, gathered all of his charts and information, worked on him for a couple sessions of acupuncture to see how his body would respond to what we're doing. And then we put in this framework. We did testing on the heavy metals and the viruses and the blood work and along those lines. And then we put together a comprehensive program at the end called the Fancy Approach, which looked like, I like to say, came into Camp Nature Cures. Even though he lives locally, I have people flying in from around the globe come into Camp Nature Cures. And why I call it camp is you're basically camped out in the clinic. Folks will come in. We do a regenerative stem cell exosome treatment. We do IV therapy. We do an intranasal procedure to help heal the brain. We take your pulses. We look at your tongue. We get your blood pressure sitting and standing. We do acupuncture directly to what your pulses told us. You'll also get Chinese herbs as a result of that. He came in, did hyperbaric oxygen, is a part of our comprehensive program. The oxygen of the hyperbaric really helps flood the brain and feed the brain and help the brain heal. And after just putting these regenerative stem cells and exosomes in there, we want to assure that they stick around for as long as possible. So that's the hyperbarics. You're breathing 95% pure oxygen with that. We were doing acupuncture on a daily basis as well. And then also laser therapy, pulsed electromagnetic frequency, which I call PEMF, and low-level laser therapy, which is low-level laser therapy, or LLLT, 660 nanometers, they're both anti-inflammatory. They help oxygenate the blood and they help with circulation. So people were coming in for the regenerative stem cell program. They get the intranasal and an IV. Then they come in for acupuncture, and then we're doing hyperbarics and acupuncture. Then we do another intranasal procedure in IV. We continue that for 5 to 6 days, depending on how long and how far somebody's come in from abroad or around the country. But super psyched for Mark's story. He was actually the first person a few years back that I did the intranasal procedure on. The intranasal procedure is we use a flexible catheter up into the nose and inserted these stem cells and exosomes right into the sinus cavity. The research shows that those go into the cerebral spinal fluid surrounding your brain stem, and spinal cord. They're there within 10 to 15 minutes. It's measurable in the research. And then they go systemically throughout your body. So we really, I learned about that technique to do the intranasal, and I've got a picture coming up of me getting it done. And I brought it to Mark's attention. I said, hey, there's this research that came out of the Neonatal International Stem Cell Conference on, really healing the brain. And he looked at me in all honesty and sternness, and he just said, hey, that's great, Doc. Have you tried it? And there was an awkward pause, and I thought, that's a great question, Mark. I have not done it. I'm going to get it done on me because I wanted to use it with my wife, Soraya, at that point. Anything to heal the brain. And he said, great, you go get it done. And if it doesn't kill you, you can do it on me. So I went and had that procedure done, and it it's definitely part of my longevity program now on an annual basis, but also it had a potent anti-inflammatory benefit throughout my body. I had chronic hip pain for a decade. That was gone. My hands, if you could see me right now, I'm clenching, opening and closing my hands, and they're not swollen anymore. They're, they feel new. They're not, I can get my rings on and off. They're not swollen. I don't have any inflammation left in my body, which is awesome. So the pain went away there. Now I know that isn't why we'd be using it for you, but probably you might have some arthritic changes or some aches or pains somewhere on the couple decades that you've been on the planet. So it's a really nice outcome side effect of a regenerative program that I put together in the Fancy Approach. So that's Mark's story. Now we're going to move over into better testing. So how to navigate a confusing condition and a healthcare system. So you got to get the right test to see what options you have. And this is where I just find complete in utter dismay at the care that is going on in neurology for you all with this diagnosis, because there's not complete workups. It's just not happening. And so these, in addition to the questions that I gave you earlier, here's the testing that I think you should have. So, and just imagine, how would it feel to have a clear idea of the root cause of your condition and what the best steps are for you? Stress in particular leads to inflammation. Inflammation puts more stress on your nervous system and can make your symptoms worse. And so we definitely want to give you a clear understanding of what we're testing for. Also give you a potential major roadmap for what your next step is, instead of just taking more drugs and hoping things don't get worse. So, the problem. So very few people use or know about these tests in mainstream medical care. Yes, these are accredited labs. They're just not in the medical system, in the Western conventional medical system. So this gives us, again, an amazing opportunity. So with a few tests, you can get life-changing insight. So, if it was heavy metal. So this picture here, this is David Perlmutter, his patient with Parkinson's. This is pulled from YouTube. I'm not going to play you the video. This was about 15 years ago. And I have been trained in environmental medicine, graduated in 2001 from Naturopathic Medical School, primary care provider in Oregon, and in particular over the last 3 years, have really become a regenerative brain specialist on how do we change the brain. This heavy metal issue is a big issue. So this gentleman has Parkinson's on there, and he had the classic stutter step, pill rolling, kind of instability, very rigid gait. And his speech was also very stuttery, gravelly, and choppy. And this was in 2 hours after getting 3 grams of glutathione push. Now, a glutathione push, glutathione is a major antioxidant that is great for brain health, and it decreases oxidative stress or free radicals in the body. And this gentleman, so it was 2 hours afterwards, 3 grams of glutathione, has this really nice elongated gait, stable, and his speech has improved as well. And I was full on amazed at this, and I had been using glutathione up to that point. I still do. I brought it in, first 5 patients with Parkinson's disease, and it was like crickets. It didn't work. And I thought, well, what in the world did he hire? Did he hire an actor or something on here? Now, I know he didn't. I know friends of mine are friends of his, and they've asked him that question for me. And it was a real live patient. And it was nothing less than miraculous, if you ask me. If you go from a stutter step gait and with gravelly voice, choppy voice, and all of a sudden your voice is strong, it's very fluid, your gait, you're taking longer steps, you're more stable. Now, on turning around, he kind of did a little stutter step in the hallway. I think some of that is just learned behavior to be safe. But it was, why didn't it work in my clinic? Well, it's because of these heavy metals. Heavy metals in North America, there's 4 that I find in most everybody. The NHANES data, there's a repository of testing on every 5 to 10 years across North America. And it shows we all have heavy metals in our bodies. So with neurodegeneration, neurologic issues, I test everybody for heavy metals. And what I found, the 5 folks that I use glutathione in my clinic with, they had very high cadmium, mercury, arsenic, or lead, or some combination of those 4. And with those in there, what it did, and here's the technical term, it mucked up the brain. And it wasn't allowing the glutathione to do its work. And so what I found, we detoxed, we chelated these individuals, and I have a story of Dennis coming up here in a minute around this particular one. It changed his trajectory. We got the metals out of his body, got some IV therapy and hyperbarics and acupuncture going, and he doesn't have a tremor anymore, right? So it is, what would that do for you just to know, are there metals involved? Because one of the biggest underlying understandings which differentiates naturopathic medicine or myself from other providers is I have a strong, firm believing your body can heal itself given the right information. My job as physician or docere, doctor, the root word of doctor is docere, is teacher, is to remove obstacles to cure. And heavy metals in central nervous system issues is a big thing to remove if you have it. Not everybody with Parkinson's has heavy metals, but you got to test for that. Hormone testing. Now, I did talk to you about Mark with his hypothyroidism. There have been 4 case studies on PubMed around correcting thyroid to optimal levels, and Parkinsonism symptoms go away. Pretty amazing. Now, what we run is a Dutch test. We look at all of your hormones. So men, we're looking at testosterone, estrogen, progesterone, and cortisol, and your thyroid. Women, same thing. But you got to turn that stone over because those hormones are big players. They interface at the hypothalamus in the brain, and the hypothalamus's job is like the switchboard coordinator, coordinating all of the information into your brain. So that's where we start seeing, speech difficulties, gait, walking ability or instability, speech tremors also are in that constellation. Some of the muscle rigidity and stiffness as well. So hormone testing definitely needs to be a stone that you turn over. The third one is viral testing. And this was a patient, Barbara. She came in with Parkinson's diagnosis. We ran the 3 viruses that we checked for are Epstein-Barr, cytomegalovirus, and herpes simplex virus. And when you go on to PubMed and research that, you can put in molecular mimicry for whatever condition. I put in molecular mimicry Parkinson's, and lo and behold, these viruses mimic the symptom picture. So if you have a high Epstein-Barr virus titer, it's saying, okay, your immune system, your vitality, your healing capability is distracted because you're trying to put out this fire over here because of the virus. Now, it doesn't mean that you're sick. Because once you get Epstein-Barr, that's the mono or the kissing disease in high school. It's pretty ubiquitous in our society for Epstein-Barr. So if you have that, as Barbara did, we went through some IV therapy to really help address that viral titer, and her symptoms got better. She had a tremor, gait disturbance of her instability of gait, and some choppiness of gait. And nobody else is looking for this, folks. And so you really want to make sure you're looking at the viruses, because if you have a high titer, it could be a game changer. Like, it could change what we're doing with you so much. It's molecular mimicry is the name of that, molecular mimicry. So it's like mimicking Parkinson's disease. The fourth one is the gut health. So gut health testing. And this is, everybody's kind of like the flavor of the month right now, the microbiome, and, the gut is the second brain. Now, we've been saying that naturopathically for decades. Constipation can show up 2 decades before symptoms. And then the whole microbiome. Interesting fun fact of the day, there are these substances called phages, Phages, that we're setting up a clinical trial at our clinic and a couple others in the Portland area to see what they do. They come into the gut and they help cell signaling and help rewire inflammation and other dysfunction of the gut, of how that's then affecting your whole body as well. So key test number 4, gut health testing. So now just imagine for a moment how different your conversation with your provider would be with clarity in any of these areas, right? And oftentimes people say, well, why didn't they bring this up? Why didn't they offer me these tests? Well, I will tell you, they didn't have the motivation that I had to go looking for the research, right? These are part of what I pulled out, what I'm calling Soraya's gifts, is that this is what I had to do for my loved one to go differentiate on a chronic neurodegenerative disease. Now, I've been running these tests for the last 2 decades on folks with central nervous system and neurodegeneration, Parkinson's, MS, dementia, Alzheimer's, and they do come up. So it can really change the trajectory and the program and really individualize treatment for you if you get the test done, right? So you got to get the test done. Dennis, so this was the other gentleman I wanted to tell you about. He had a tremor as his primary issue. And we found a heavy metal burden for him. I believe it was lead. He was big into construction, kind of do it yourself at home as well. Found the heavy metal burden, and we did hyperbaric oxygen, which is this as you go into a little chamber, you zip it up, breathe 95% concentrated oxygen, and you turn the atmospheric pressure up around the body. That's why it's called a hyperbaric chamber, which then creates this gradient. So oxygen likes to go from a high concentration, which would be in the tank, into a low concentration, which is in your brain. And so it really helped drive the oxygen into Dennis's brain. He doesn't come in anymore because I hear from other people that I treat that are in his church. They say, hey, Dennis is doing great, doesn't have his tremor anymore. He only gets it if he gets really upset and angry. So how would that be for you? If you only had, if we could get rid of that, right? Perfect. So that's Dennis's story. We're going to come down here. This is just me. This is me in that training that I talked about. I no longer have the goatee. Might have to update my slide there. But this is really what I put together over the 2-year period of what I call better next steps. So first part, ask those questions of your providers to make sure you're getting adequate and comprehensive care. Second one is make sure you get these tests done so that you have all of the information you need to make an informed decision and make sure you're getting the best, most comprehensive care. And what I did is I systematized that and I turned it into this fancier approach, FAN-C. So this is the intranasal procedure. I've since, that's 1.0, 2.0 on this is you don't need to tilt the head anymore. We've got it set up with a pillow. It's a flexible catheter. There's no pain with that. For me, it got rid of, I have some middle-age vision loss and hearing loss. I wear hearing aids, genetic disorder in the men in my family. I also had chronic hip pain for a decade. I was out in Colorado inner tubing and went over a waterfall. I had my then 6-year-old boy on my lap. The inner tube went flying and my papa instincts were to grab the boy. So I grabbed him and my right hip hit the rock in the bottom of the river. And from that point, I had hip pain for 10 years. And I'm in the industry. I was getting acupuncture and chiropractic, naturopathic manipulation technique, injection therapy, physical therapy, massage therapy. You name the therapy, I was getting it done. And I was always playing catch up with pain, like waking up in pain or going to bed in pain, wondering, okay, am I going to have any energy tonight to make it through, or is the pain going to get me? So that's where this fancy approach comes from, and those were some of my experiences that I had there with using the intranasal procedure. So the problem, the opportunity and options to have a better quality of life that you have not been informed of yet. So, again, what I just shared with you, I am saying we are not giving you complete comprehensive care until you ask those questions and you get those tests done. Because without knowing what the answers are to those, it can really dictate what we do for your treatment. So again, with all problems, there's an amazing opportunity. So knowing your options for proactive approach and having a clear path to get there. So I like to say, I don't treat conditions, I don't treat symptoms, and I don't treat disease. I treat whole, dynamic, heart-centered people. It is a pleasure to serve people, and it's truly where true health comes from, right? Healthcare really should promote thriving, and we've got to address you as the unique, heart-centered individual that you are. And so you got to have an adequate workup. But that adequate workup can open the door to tremendous change and opportunities for you. So functional, this fancy approach, what I've been talking about here. The F is the functional approach. That's the whole heart-centered dynamic being moving through time and space. So it's an integrative, naturopathic Chinese medicine approach. We address and treat people, not disease processes. The assessment, this assessment is crucial, right? Because there is no lab test for Parkinson's disease. There's no imaging for Parkinson's disease. But what I just showed you was a functional approach. You got to make sure, why heavy metals? Well, your brain is predominantly fat. So we store toxins in our fat. So we want to look, okay, what's your body burden? So what does that look like? Well, you take a early morning pee, you take an oral capsule, and this is something that we can ship right to your house. Before, I do this for folks before they come into the clinic. So we get these tests done so we can hit the ground running with them. So you do that, you take the oral DMSA, and then you collect your urine for 6 hours thereafter, and you send it directly into the lab. That's for the heavy metal burden. So we want to make sure you got to rule it in, rule it out. Like for Dennis, that was his chief issue. And once we got the lead out, so to speak, and got some oxygen therapy and circulation with the Chinese medicine acupuncture, his tremor went away. For Mark, it took a little bit more, right? He didn't have the heavy metal burden, but he had the hypothyroidism. For Barbara, she didn't have the heavy metal burden, didn't have the thyroid issue, but she had a viral issue. And now what I put in is that the GI MAPS testing, so on gut health and testing the microbiome to make sure you don't have any commensal infections going on there and that everything's in the correct balance. Because there's new research coming out of Europe on these phages looking at cell signaling, and I really do think that's how the regenerative stem cell program works, that basically my Camp Nature Cures using this fancy approach works, is it's rewiring your body symphony, gets the tune playing better, and gets you playing a better tune, which is back to Wellville without symptoms. Nerve health is N is for nerve on the fancy approach. So this is the B vitamins, vitamin D, glutathione, cannabidiol, CBD. That's kind of all the rage right now. People hearing about that everywhere. There are specific Chinese herbs that we prescribe to your pulses. DMSO, HOCl. This is a nasal spray that I found. DMSO is dimethyl sulfur oxide. It was developed in the 70s to treat racehorses, their arthritis in their hips. Stanley Jacobs, medical doctor up at Oregon Health Sciences University in Portland, he did the predominant amount of research on DMSO. And thankfully, in my career time, I shared 2 patients with him. So honored to have a patient in concert with him. So did know him, not personally, but more professionally. And DMSO is a standalone treatment for brain health and bringing inflammation out of the brain, bringing oxygen into the brain. So I coupled that DMSO with HOCl, which is anhydrous chloride. Both of these have been shown to have proteins. Remember back to the beginning when I was talking about misfolded proteins here, reconfirm into a normal shape. There's over $2 million of NIH research on anhydrous chloride. And I've got patients using that spray, and they're getting 4 to 6 hours relief with their speech difficulties. So if you're out there and you have any stuttering that is occurring with this disease condition, any slurring of speech, weakening of the voice, this might be something that you want to look at. But I wouldn't start with putting B vitamins in or vitamin D or glutathione. Don't do that and say, oh, this didn't work for me, doctor. That Dr. Eckel doesn't know what he's talking about. Because the step before this, right, remember, was assessment. So we got to make sure we're assessing you properly. Big piece in the fancy approach here. And then the most powerful thing that I found in 18 years or 2 decades of practicing medicine is cell regeneration. And I've been using regenerative stem cell therapy, the exosome. So the exosome, what is that? Exo is out of, some is the cell. So these exosomes are little packets or bundles that are secreted out of stem cells, and they include growth hormone, growth factors, anti-inflammatory cytokines. And so it is cell signaling really is the way that this works so well for folks. And it is one of the biggest bar movers that I've found for Parkinson's and neurodegeneration in general. So it's it is time to start treating the whole person in this transformational program. So, really what I put together in that fancy approach is 18 years of clinical experience. You get Dr. Eckel that kind of went through major tragedy with losing his wife, but also provider with a purpose and passion is to help as many people as I can. I don't want other people to suffer the way that we went through that. And if we can move the bar, make a difference, we're improving our patients' quality of life. The Go Wellness Network that I talked about, that I'm the clinical director of excellence for, we've had over 2,000 of these brain procedures. Now, that's not of my fancy model, but that's using the regenerative stem cell procedure with the intranasal and IV. And we do show statistically across the 40 offices with everybody treating about 50 people a week is 95 to 96% improvement rate of the diagnosis. So, we are getting a really good result for folks. So the brain smoothie recipe. So here it says click to download. We're actually going to send that to you in a follow-up email. So be sure to click on that. And then the other component. So thank you for making it this far. I also want to offer you a gift. So, a component of this is, what's the value of discovery that showed you a way to boost your quality of life, your longevity and clarity? So, what I'm talking about, like same process that I walked through with Mark or Dennis or Barbara, countless patients over the years here with Parkinson's diagnosis of, 30 minutes with me on just a clarity call. So, the component as to why you showed up, you want to get your power back from the confusing and indifferent healthcare system. And really, may I show you something amazing? My purpose is to help as many people as possible. And I'd really like to share this opportunity with you. There is no cost, and it is just out of the, giving of my heart. I want to be in service to you. I have patients, calling in from around the globe looking for this information. And we put it up there. Usually put it in the chat box there. You can just click there too. I will really strongly encourage you to just click it. There is a form on there that I'm asking you to fill out. So it just has some simple information, but it helps to maximize what we do on this 30-minute call. It asks for your name, what treatments that you've tried, what medications you're on, a little bit about what's your ideal provider type, like on, how much guidance you need. So those are all on there. That's all we're doing with that. And then my staff is going to go through that. And this is on a first come, first served basis. I have some times actually set aside tomorrow morning. So we'll see if we can get even some of you in on Monday morning on a call with me. And that's all it is. It's a call, and it's 30 minutes. It's complimentary, 100% free with me. We're going to go through that form and then hit the ground running to see, maybe you've had a couple of these tests or you have other specific questions. You're also welcome to put your questions right here in the chat box too. But I really want you to find out if you have some opportunities or options that you haven't considered, right? There is nothing worse. I see so many folks coming in with mood disorders with this diagnosis because there's really not a lot of hope. I had a patient fly in from Connecticut recently, and when she came, in the treatment at Nature Cures, we did the fancy approach, and she was able to lift a glass of wine up to her lips without shaking. It's the first time in 8 years she was able to do that. She was able to hold a yoga pose without shaking in her leg. And to me, that's what gets me up in the morning, is to see, can we move the needle for you all? So, please take me up on this opportunity. And click that link there. We're also going to email it to you as well if you're driving or on your phone. So that's going to be coming in, but it is on a first come, first served basis. I have a strong purpose and passion to help you. And so please, take me up on that. So that's kind of the next couple slides are just talking about that, this healthcare clarity roadmap. It's private coaching call directly with me. You'll discover your options and opportunities to maximize your quality of life and minimize the symptoms of Parkinson's. It's get the roadmap. You book the call, you get informed, and then you take your next steps. We want to really keep it simple. We want to improve your quality of life, and I'm seeing it. It's very gratifying on a day-to-day basis. It's why I'm out on a Sunday talking to you. Instead of out with my family, I have a strong purpose, and I really, I want to move the needle. And so we want to make and tailor the information directly to you. So it's not a one-size-fit-all program at all. But this is just a call. So, you push the button, it's going to take you to a form. You fill out answer some brief questions, and then click send. That goes to my staff inbox. They're going to screen them to make sure we're a good fit. And then we're gonna get back in touch with you and see if we can get a time that works. And then during that, we're gonna do 30 minutes together on the phone, and we're gonna talk about exactly what you need to do to take the next steps. So that is that. So what you get, a detailed 30-minute assessment of your health, not a 2-minute prescription, a personalized strategy to help you live your highest quality of life, and recommendations on your best next steps. There are some bonuses just to sweeten that up. So one, it is this call. Usually these consults, I charge $287. This one I am just giving to you. So click it. And then the second one is those tests that I just talked about. I put together a discounted bundle. Perhaps you don't have a provider that is able to run those tests. And I don't really make money on those tests. I really want to see, can we move the bar for you? And so we really get that moving for you. We'll give you that information on the call. The third is the neurologist question script. So those questions to ask your neurologist, we're including that in this whole bundle as well. So, just think about it. If all this did was get you to the right practitioner, or got clarity about the root cause of what's going on for your neurodegeneration, Parkinson's, or even just led you to some modern treatment options that you haven't considered yet, do you think it would be worth it for you? So I would say, yes, it is. And I really feel like I'm doing you a disservice if you don't click the box. So I know I'm saying it a bunch. Life gets busy. So what I found when I'm talking to people, if you don't take action right now, life gets in the way, and then it's like 1,000 things comes up. So, I really, take what you've got, you learned today, get on the call with me. Let's just talk about it. There's no commitment in that call other than making the call. So let's get on, let's talk. You've heard my voice here for an hour. I want to applaud you all and thank you for coming out on Sunday. And, if you learned some great information, please share this with friends and family. I'm really out to move the needle. And just click that link. We'll send it to you in an email as well, follow up. Again, thank you all for coming out. If you've got questions, put them in the chat box now. I'm the leading naturopathic physician in neurodegeneration nationally. I've got a cadre of patients flying in from around the globe for this fancy approach. We call it Camp Nature Cures. We include in that whole program airfare and lodging as well. We just really want to make sure you're well taken care of if you decide to come out for that. I went through it personally, the maze of healthcare, and it is broken. I know firsthand, and it's very frustrating. You got it pieces and parts, and you're going this way and that. At one point, they wanted us to do the whole battery of tests again with my wife, Soraya. And for them to even consider asking me to do that, I just thought, you all don't know what it is to live with this condition. And it's hard, right? That you want, maybe you should come in for this new imaging. And yeah, the contrast dye. So I want one of those MRI with contrast dye. Again, the loss of the dopamine and dopaminergic receptors is such a small piece of the puzzle, and why we haven't had any breakthroughs with Parkinson's disease to date is because we're looking at the wrong stuff. So here I am again, a little outdated with my goatee. I lost that a bit back, but you can go on my website, Nature Cures Clinic. You can see some up-to-date photos of what I'm looking like. I am a man on a mission. I'm actually looking at creating some clinics across the country to help, because I'm finding you all are underserved and people are not giving you complete assessments or workups, and let alone no treatment options. So that's what we're up to. I got a fire lit under me, and I'm getting this message out. Again, just out. These are folks I'm helping that are just like you, perhaps, with your speech is going, maybe you're getting a weakness of speech or slurring of speech, a tremor is worsening or spreading to both sides of the body. You're having difficulty walking. I know it can be scary. It can be overwhelming. We help hundreds of patients every month with this condition. So book your call. We've got the link in the chat box. And want to really just make sure what you're going to see when you click that link. There's no scary anything on the other side. It's just a form. You just go there, click that box, and fill out some questions, and then we'll see if we can get you into the clinic as soon as on the phone as soon as possible. I do Zoom calls as well, so we can actually see each other. Again, my hope to you, I hope you got a lot of value out of today's sharing. These are Soraya's gifts. My purpose is to help you. I've been through it as a husband and as a provider. I created my clinic to be of service to humanity and to you. And I treat people, as family members, and really the ones that you love. So I hope that you got a lot out of today's talk. Please click that box, that naturecuresclinic.com, book a call. It's up in the chat box. We are also going to send that to you in your email. And then the two things, the smoothie recipe as well, we'll get that out in an email where you can just do a quick download on that, and then the book your call. All right, all. Thank you all for coming. We're going to maybe turn it over to some questions here.
Yeah, there was several questions that came in. Sheila just asked, I was diagnosed with DAT scan. Are you saying the dopamine receptors don't diagnose PK? That's the last question that just came in.
I was diagnosed with DAT scan. Oh, yeah. Are you saying the dopamine? Oh, yeah. So, no, I'm saying it's just not, there's no definitive diagnosis for Parkinson's to date. Right? I know the imaging is coming along quite a bit, but if you're looking at what I'm trying to break, and it's a great question, but Parkinson's disease is much larger than just dopamine receptor breakdown. And I really want everybody to leave with this, because if you're only looking at that, what does that leave you? It leaves you going on levodopa, the Cinemet, carbidopa, levodopa, and which is not corrective by any means. And wouldn't it be? It's not. We haven't had any breakthroughs in Parkinson's disease because everybody's only focusing at those end stage receptor sites. So what I'm saying with that is it's not definitive. And you really should have the other antibody testing done. What I mentioned in that first slide of questions to ask your neurologist of, do you check for other conditions that could look like this? And so, it's great that you have it and okay, well, I have a neurodegenerative state, but you really want to make sure you're turning over these other stones, because these things could lead to other breakthrough treatments for you. So great question.
All right. There was a couple of other questions that came in. One of them was, does insurance cover the testing that you mentioned in that second section with the type of tests that people may want to have?
With other tests, like the other ones that I haven't mentioned.
Yeah, I think in general the question was, does insurance cover the testing?
Oh,
and I take it to mean that the ones that you covered in that second session, the gut health, etc.
So unfortunately, as of to date, they do not. So what I have, I really try to deep discount these things to make them really affordable so that folks can get them. My encouragement for you would be to book the call. We'll get those particulars. We don't even know if you need all of the tests either. So we really Maybe you've had pieces and parts of those tests. So I don't want to recreate the wheel for folks. So, but insurance does not cover that. And one word on insurance too, insurance is not going to pay for your wellness. And boy, they are not going to pay for this corrective care or any options for you in the Parkinson's realm, right? They're going to pay for your annual exam up there, maybe some imaging, and then the meds. But there's nothing in there. It's like a slow, steady decline to Symptomville is what I call it. So unfortunately, to date, insurance does not cover those.
All right. And then related to tests, why hasn't my neurologist suggested these tests? This came in from John.
Oh, great. Yeah. So, again, and I covered this a little bit earlier, but I'll go over it again. These are newer tests out there. One, insurance doesn't cover them. Two, there's no rep coming to their office to have them look at this. And three, they are treating a diagnosis and a disease process. What I just laid out here is really how do we treat people as whole dynamic beings and really open up some opportunities or some other areas of focus. Like the neurologist is going to say, you want me to run a stool test? No, you got to go see the gastro doc for that, right? Viral panel, that's not my realm of expertise. I deal with the brain and the nerves. You got to go see the immunologist for that. So they're piecing and parting you where really we need the meta-analysis. You need a provider that understands the whole dynamic, unique you. Yeah, great question.
Got it. Yeah. The other part, and this was in response to earlier, is that, for people coming in internationally, how does this work? I mean, you briefly talked about what it looks like working with you, but the question was, how does it work for international patients? Do you work with long distance consultation? Do I keep my neurologist, or do I have to come to Portland to work with you?
Oh, yeah, great question. So I do have people travel in from around the globe, because what I found is folks, when you bring this up locally, they don't know what you're talking about, right? So I've really put together one of the most robust, comprehensive programs on the globe at this point. But there is the caveat to that. So we start remotely. So we get on that call and we can talk about your particular needs and your situation. So please make sure you click that now. And then in addition to that, so what it looks like, we get on that call, you fill out the form, we talk about your specific situation. We can figure out what testing you may need. We can ship that to you. So I've shipped it to India, I've shipped it to Canada, we've shipped it to Asia as well thus far, down to New Zealand as well. And then we gather that information so that we don't waste any time. If you decide to fly into Portland, now, Portland is a fun town and it's a foodie town. So it's kind of like a medical vacation. You come out. Actually, the woman from Connecticut, she's the most recent person that left a week ago. And on her last day, she's like, when do I get to come back? She said, that was the best care I've ever received in my life. And she didn't even leave yet. It was like, no, go home. Let's, we have some follow-up and some other, support that we do throughout the year. And then we can reassess that down the road. But I'm not finding folks need to come back in. So there might be some home care that you get as well. So I can coordinate that, but really ultimately we want to look at, okay, what is your specific need? Where are you missing information? Let's get that. Let's look at what the next steps are, and then we can move from there.
Yeah, that's so far all the questions that I had from the audience.
Awesome. Any last questions out there? Again, I just want to make sure, just do the simple thing, click on that link, get on, send that in, we'll get some information from you, and then we'll just talk like this either on the phone or on Zoom. We can see each other as well. I'd love to connect up with you and be in service to you. All right, all. Well, thank you for coming out on this Sunday, and I really look forward to talking with you soon.